Welcome to Medent tutorials. This is medical licensure exams preparation. So these are just high yield MCQ questions on the cardiovascular system. And this is the first video of many to come. So sit back and let's enjoy this together. So which of the following is not correct concerning the location of the heart? So basically, this is where the heart is located. As you can see, there is a mass here. Here, this is the heart. Okay. Then this is also the heart. So anatomically speaking, we are saying that the heart is located superior to the diaphragm. This thing here is the diaphragm, and it is located superior to it. This diaphragm actually helps you to breathe in and breathe out when it contracts and then it relaxes. So that is how breathing occurs with the use of the diaphragm. Now, in relation to the spinal cord, the spine is posterior to the heart. In other words, the heart is anterior to the spine or to the vertebral column. Again, the heart is in the mediastinum, is in the middle, or it is in the mediastinal space. That is to say, it is found between the right and the left lungs. Found between the right and the left lungs, but more inferior, but between the left and the right lungs. But it is more shifted to the left lung, So as you can see over here, so these are the two lungs here and here. So this is lung A, lung B, all right? This is where it is. So basically it is inferior, right? But on the more to the left side of the lungs. So that is how the lung or the heart is located in the body. So from the question, which of the following is not correct concerning the location of the heart? Our answer is definitely B. That is the superior to the lung. It is not. It is rather inferior to the lungs. Now, the heart muscle is also called, so even by the name heart muscle. So in medicine, when we say heart, we're referring to cardio, right? When we say muscle, we're referring to myo, as simple as ABCD. But before we zoom into the answer, it is worth knowing that the heart has three walls, or it has three layers. We call them the epicardium, the myocardium, and then the endocardium. So epicardium, myocardium, and then endocardium. Now the epicardium is the outermost layer of the heart, and it is sometimes referred to as the visceral pericardium. I repeat, epicardium is different from pericardium. So epicardium is simply the visceral pericardium. Now, what then is pericardium? So the pericardium is the outside layer that does not compose of the heart. So that means it is not actually about the heart, but it is surrounding the heart. So it is not the outermost layer of the heart. The outermost layer of the heart is the epicardium. However, outside the heart, we have the pericardium. But pericardium also has two layers. We have the visceral layer and the parietal layer. So it is the visceral layer that is actually attached to the epicardium. And that is why sometimes we say the epicardium is referred to as the visceral pericardium. I hope this makes it easy for you to understand. Now, the function of the pericardium is that it houses some fluid that helps to reduce friction to the heart and protect it as it forms, right? Now, we have the middle layer called the heart muscle or the myocardium. This comprises of the middle and the thickest layer of the heart wall. And then finally, we have the endocardium. pericardium, which is the innermost layer of the heart. So from the diagram over here, it illustrates everything that you need to know about the heart wall. So we have, again, we have here to be the endocardium. We have middle layer, which is very thick, to be the myocardium. And then we have this layer here, which is the epicardium or the visceral pericardium. And then you see outside it, we have the pericardium, which also we have what to call the parietal pericardium. Then in between it, we have the fluid. Normally, it contains about 50 mils, okay, about 50 mils of fluid in there to help you to protect the heart from any sort of friction and things like that. But over here, our question is what? The heart muscle is also called basically the myocardium, and hence your answer is D. Good. So now we have what to call the epicardium. Now you understand that is the outermost layer of the heart. The outermost layer of the heart. We are saying that it is the same as the visceral pericardium. We have talked about it in the previous question. So basically, your answer here is C, the visceral pericardium. Now, blood vessels that carry blood away from the heart are called blood vessels that carry blood away from the heart. So, of course, in school, we know that arteries carry blood to the heart, sorry, away from the heart, and veins carry blood to the heart. In other words, arteries carry oxygen or oxygenated blood to the whole body. So it carries it away from the heart. Whereas the veins, which will now carry deoxygenated blood, it will now send those blood into the heart. So again, arteries carry blood away from the heart, whereas veins carry blood towards the heart. So over here, your answer is B. So the tissue which forms a loose fitting sac around the heart is called, so again, this is what I was discussing. So basically, they talk about the pericardium, okay? Because it's like a sac, a loose fitting sac that is surrounding the heart. So it is not necessarily the outermost layer of the heart, but rather it is surrounding the heart. It is surrounding the heart. So good. So this is what we have. So it is surrounding the heart. So again, we have the endocardium, the myocardium, and then we have what? The epicardium. And of course, we have the pericardium. So when we talk about the loose fitting sac around the heart, we're actually referring to the pericardium, which is very fibrotic in nature, or it's a fibrous connective tissue. It is a fibrous connective tissue, or it's made up of a fibrous connective tissue. And again, this is also called what? The parietal pericardium. So your answer here is D, the parietal pericardium. Now the valves between the left ventricle and the valve between the left ventricle and the blood vessel leaving the left ventricle is called what? Very basic. So let's quickly understand some small anatomy over here. Okay. So looking at, don't focus on the arteries and the veins for now. Focus on the heart, this heart. Focus on this heart. Okay. So basically, we have the superior vena cava and the inferior vena cava, right? Coming into the right atrium. From the right atrium, it passes through what we call the tricuspid valve. So this valve here is called tricuspid valve. So moves blood from the right atrium to the right ventricle. And then from the right ventricle, blood flows into the pulmonary artery through a valve called the pulmonary valve. Then again, when the blood goes into the heart, so into the lungs and is coming back again to the heart, it's usually what we call the pulmonary vein, enters into the left atrium through a valve into the left ventricle. Now the valve here is called what? The mitral valve. The mitral valve. into the left ventricle. Then from the left ventricle, the blood flows from here, which is oxygenated, right? Moves into the aorta through a valve called the aortic valve. So again, the question says, what is the valve between the left ventricle, which is this, right, and the blood vessel leaving the ventricle? So they're talking about what? The aorta. So what is the valve between the left ventricle and the aorta? And your answer here is what? The aortic valve. That's over here. Your answer is C, the aortic valve. Now again, the aortic and the pulmonary valve, we call them semilunar valves. Whereas the valves, that the tricuspid valve and the mitral valve, together, we call them the AV valve or the atrioventricular valve. That's artery and the ventricle valves. Now, the smallest type of blood vessels are obviously, these are just the what? The capillaries. So this is what it is. So capillaries are the smallest blood vessels in the body. They are very tiny, extremely thin-walled vessels that act as a bridge between arteries and, of course, veins. So it's a bridge between the arteries, which carry what? Blood away from the heart, and the veins, which carry blood back to the heart. So when the tissue through the capillary system uses the oxygen, it takes it back into the veins for it to go back into the heart for oxygen to be filled again, and it will come back again. That is how it is. That's the cycle it is. So that is the smallest vessel in the body or in the blood. All right. So over here, your answer is the capillaries. The capillaries. The capillaries. So the fluid-filled sac that surrounds the heart, again, we'll talk about it. That's called the pericardial fluid, right? Yeah. So the sac is called the pericardial cavity. The sac is called the pericardial cavity. So the fluid-filled sac that surrounds the heart, of course, is the pericardium. So your answer here is A. Blood exits the left ventricle in which of the following blood vessels? Again, we've talked about it already. So with the same preamble or the same diagram, so we're talking about what? The left ventricle leaving, so blood leaving the left ventricle through this vessel. What do you know that vessel? Definitely the aorta. Definitely the aorta. So your answer here is D. Compared to an artery, the wall of a vein differs in which of the following way? So that means now it's about the difference between an artery and a vein in terms of whatever it is. Okay, so let's quickly look at it. What are the difference between a vein and an artery? With that, I'll use a diagram, or I'll use these diagrams to help you understand it better. So basically, you have to understand that arteries have very thick muscular walls, or the tunica intime. So the tunica media, that is the middle layer of arteries, is made up of what? A lot of muscles, and it's very thick. So we say it has a very thick muscular walls. Whereas the veins have very thin muscular walls. So one difference is what? The thickness. So the arteries are very thick, veins are thin. Now, arteries have a very narrow lumen. Narrow lumen, whereas veins have a very broad or large lumen. Now, arteries have no valves, but veins have valves. Arteries have no valves, but veins have valves. Okay, so again, let's come back to the question. So, which of the following ways are we going to compare the two? So, definitely, question A or answer A, option A is what? The middle tunic is thin. So, in veins, of course, The middle layer is very thin. So over here, you can easily see it over here. So they are referring to this portion. This portion over here is very thick in the artery, but very thin in the veins. So we say that will be our answer. The rest are actually correct for both of them, right? They are all lined up at endothelium. They all contain smooth muscle. They also have three layers, and the layers are the intima, the media, and then the external, or the middle, or the inner, the middle, and then the external, or the outer. Now, veins have a very extra large layer of what muscle. That is, veins have an extra layer that I don't get it right, you know. But here, your answer is definitely the middle layer is very thin. I don't know if it is saying that the outermost layer, because the outermost layer has a lot of connective tissue in veins than in arteries. The diagram here didn't give you a true picture of how the external or the outermost layer actually really looks. Okay. All right. So definitely answer is A. Now, most often, systemic arterial blood pressure is measured in this artery with the, auscultatory what method using a stet and a sphic. In other words, which artery are you going to use when you are doing your BP checking? As simple as ABCD. And of course, this is what they really mean. So, what do you normally do when you are doing this kind of procedure or this kind of checking or vital taking? What are you actually looking out for? Which artery are you trying to palpate, or which artery are you trying to make sure is there? Definitely, you are thinking of what? Of the brachial artery, the brachial artery, the brachial artery. All right. Now, which of the following vessels is not part of the systemic circulation? So, systemic, that means blood from the left ventricle, right, moving through the aorta into the system circulation and coming back into the heart. That is systemic circulation. Which of the following blood vessels is not part of it? So let's look at it over here. So this is our circulatory system. So the highlighted versions or part, which is from here, so you can see over here. So good. So that means that the left ventricle, the aorta, which is a vessel, the arteries, the arterioles, the venous, the veins, the vena cava, they are all part of the systemic circulation. So from the option, which of the following is not? Now, if you take the, how do you call it? The coronary artery that supplies blood to the heart, right? The carotid artery, you know where it is. Look at the pulmonary artery, for example. Pulmonary artery, where does it go to? Look at it. This is the pulmonary artery. It is in this part, right? Pulmonary artery is involved in the pulmonary circulation, not in the systemic circulation. It is involved in pulmonary circulation or the lesser circulation or the low pressure circulation. And that is why your best answer will be C, pulmonary artery. It is not part of systemic circulation. But inferior vena cava, although they are all part of systemic circulation. Which of the following is not one of the great vessels? So again, the great vessel, when we say great vessel, what are we referring to? These are simply large arteries and veins directly connected with the heart. Large arteries and veins that are directly connected with the heart. These are called great vessels. And basically, it consists of the, let me bring them down over here for you. We have the inferior vena cava, the superior vena cava, the pulmonary arteries, the pulmonary veins, the root of the aorta, and every other thing concerning it. So these are the greater or the great vessels of the heart. One or the other, they are connected with the heart. Majorly. Majorly. And that's over here. Your answer is C, coronary artery. So coronary artery, so where are they? These are the coronary arteries. For those wondering what it refers to. These small arteries here, these are coronary arteries. These are coronary arteries. Okay. These are coronary arteries. All right. So as soon as the aorta comes, it branches. So there's the aorta. Small branches from it form the coronary arteries. So it is not a major or a greater vessel. Now, during the period of ejection in the cardiac cycle, when we say ejection, we are simply referring to what? To expulsion of blood from the left ventricle. As simple as ABCD. So during the period of ejection in the cardiac cycle, the AV valves, again, what are the AV valves? The AV valves are the mitral and the tricuspid valves. These are the AV valve or the atrioventricular valves. So during ejection, what happens to those valves? And then what also happens to the semilunar valves? Again, semilunar valves are referring to the aortic valve and the pulmonary valves. So what happens to these openings? So now, it's good to understand that when the ventricles contracts, that is ejection. So ventricle is contracting to push blood away or to push blood to the aorta, right, into system circulation. So during ventricular contractions, as a result of ventricular depolarization, the pressure inside the ventricles will increase, right? When that increases, immediately after the ventricles start contracting and the pressure increases, the ventricles or the pressure in the ventricles would exceed the pressure in the atria. I repeat. So as soon as your ventricles contract due to the ventricular depolarization, immediately pressure in the ventricles will exceed the pressure in the atria. And what happens? It will force the AV valves to shut or to close. And of course, if the AV valve begins to close because of the pressure, so that blood doesn't flow backwards into the atria, then it also opens another door, which are the semilunar valves, so that the blood or the pressure inside will also be reduced because the pressure will definitely push blood away from the ventricle. And that is how ejection in cardiac cycle, that's exactly what is happening. So during the ejection or during the ventricular contraction, the AV valves are closed, whereas the semilunar valves are opened. All right. So basically, that's just what it is. Okay. So again, just to illustrate over here, when these parts, these ventricles, left and right ventricles contract, pressure here, and here will increase, and that will force these ones to close, right? So that blood does not flow backwards. As this one is closing, this one will also begin to open. That is the semilunar valve. They will open so that blood will move out of it. So again, your answer here is D. The AV valve will close and the semilunar valves will be opened. The most common site for taking blood sample is the, sorry, the most common site for taking blood sample. Every student, this one there, we all know it definitely is the median cubital vein. The median cubital vein. So basically, the diagram has just shown you what it really means. Almost every student or everyone likes to take blood sample over there because the veins are just so obvious to see or to palpate. All right. So definitely your answer here is B, the median cubital vein. Which of the following does not aid the return of venous blood to the heart from the lower extremities? Okay. Very beautiful question. So, how does blood get into the heart? Basically, that is what you need to know. And there are a lot of mechanisms which is involved. So we'll go through them one after the other. Okay. So we have to call the respiratory pump. It is involved in pushing blood to the heart. How does it do that? So during inspiration, what happens? There will be low pressure in the thorax. Why? Because this diaphragm here, this diaphragm here, this diaphragm here will contract. And when it contracts, what happens? The normally when it's relaxed, it is dome shaped. It is like this when it is relaxed. But when it contracts, it flattens. It flattens. And when it flattens, that means that there'll be a lot of space in the thorax, and that will cause what? Low pressure in the thorax. Mhm. And what happens? Air will then begins to move down the pressure gradient because the outside will be too much pressure in the outside. So pressure will move from the high concentration to the lower concentration, isn't it? Basically. So that's what happens. And that will allow you to inspire or for you to breathe in. Now, as this is going on, it also increases the rate of cardiac return. How? Again, the low pressure will draw blood into the right atrium. Don't forget that the heart is connected. So let's say this is where the heart is, right? Yes. Don't forget that the heart is always connected to the lungs. So now here's the case, there is low pressure in the lungs. So that low pressure will in turn affect the heart. And what happens? That means that the pressure in the heart is also low. So it means that pressure in the inferior vena cava, the superior vena cava will be higher. So it will move blood into the low pressure chamber, which is the heart or the atrium, the right atrium, right? So that is how it pulls blood. It pulls the blood. That is how it pulls the blood. So basically, that is how the respiratory pump helps in pushing blood to the heart. So yes, it works with respiratory pump. What other way does blood helps? I mean, what helps blood to move into the heart? Again, your calf. Your calf, very, very important part of your body. We call it the muscle pump. The muscle pump. Uh, so when the muscle contracts, or when the skeletal muscles in your calf contract, it actually pushes blood towards the heart. It will push blood towards the heart. As simple as ABCD. All right. And again, veins have valves to prevent the backflow of blood. And because they have valves, again, this helps to propel blood into the into the heart. Then of course, you know that compared to the arteries, veins have larger lumen. It have larger lumen, and these all together propels blood into the atrium or into the heart for oxygen to take place. So in all of these, it is gravity that does not aid in the return of venous blood to the heart. Hey, doctor, yeah, but why is it that anytime people are having swelling, we say they should put their legs in a pillow? Yes, that is for what? For fluid to move. That is for the swelling to reduce, but it's not necessarily preparing blood into the heart. No. So the answer here is A. So gravity is not. All right. Now we do the following. Indicate atrial depolarization in an ECG. In an ECG. So basically, we have to look at what an ECG is, right? Good. So let's use this one to describe everything so that we'll be out of here. So we have the P wave. So the P wave actually talks about what? Depolarization of the atria in response to sinoatrial node triggering. So anytime there's an impulse, the first thing to depolarize or to undergo depolarization is the atria, and that produces a deflection called the P wave, and hence, so it produces a positive deflection, and hence it goes up. It goes up. All right. So that is called the P wave. So P wave stands for depolarization of the atria. Then we have the QRS. The QRS. So the QRS talks about depolarization of the ventricles. They also have a short look at it. There's a delay here, something flat here, right? Something flat. We call it the PR. This one is R. We call it the PR interval. So anytime there's PR interval, that means there's a delay of the AV node, delay in the AV node to allow filling of the ventricles takes place at the PR interval, right? At the PR. When we do ECG, we'll move deeper into all of these things for you to understand better. Because your heart or the electrical activity of the heart doesn't just beat, no. It goes through up, down, flat, up, down, all of those things. That means that you are alive. But when it is very straight, it means you are gone. That is just by the way. Aha. But don't worry, we'll find time and we'll talk about all of these things in details. What is T wave? T wave refers to the ventricular repolarization, or when the after contracting, it has to what relax so that air will fill. Sorry, blood will be filled again. So that's called the T wave or the ventricular repolarization. Ventricular repolarization. Basically, that's just it. We also to call the U wave, which I didn't show over here. So the U wave actually, what does it refer to? It refers to how do I put it? Normally, it comes after the T wave of the ventricular repolarization. Okay, it may not always be present, but basically, it is representing repolarization of the Purkinje fibers. Repolarization of the Purkinje fibers, but it's not always present on an ECG strip. Okay, that is why it is just you over there. So we call it the U wave. We call it the U wave. So basically, that is just it. All right. So over here, your answer is definitely what? C, P wave, because atrial depolarization, that's the P wave. Okay. If the AC node becomes damaged, don't forget the AC node is what fires or what sends impulses to the atria to start contracting, right? Now, if the AC node becomes damaged and non-functional, which of these is the most likely to occur? So this question will now put our minds on a concept called automaticity. Automaticity. This is just a property of the cardiac cells to generate spontaneous action potentials or initiate an electrical impulse in the absence of an external electrical stimulation. I repeat, it simply refers to the ability to generate impulse spontaneously or spontaneously, sorry, spontaneously in the absence of external electrical stimulation. Now, we have some things in the heart that are able to do that. These are the AC node, the AV node. Some even add the bundle of His and the Purkinje fibers. All right, so basically, this is what I mean. So we have the AC node here, the AV node is here, the Purkinje fibers are here, or sorry, the bundle of His. Then the Purkinje fibers are somewhere here. Somewhere here. These are the Purkinje fibers. All right. Now, how will I know that this heart is beating from the AC node or from the this node or that node? So normally the AC node will beat at a rate of 60 to 100 beats per minute. So if your blood pressure, sorry, if your pulse or whatever it is, or your heart rate is around 60 to 100, it means that it is coming from the AC node. If it is between 40 to 59 or between 40 to 60, that is coming from what? The AV node. That's coming from the AV node. And again, if it is less than 40, okay? If it is less than 40, but if it is less than 40, but more than 20, we can say it is from the bundle of hairs. And if it's less than 20, we can say it is the Purkinje fibers. As simple as that. So definitely, when the AC node, would the heart stop? Definitely not. But would the heart beats faster? No. Because the fastest is the AC node, right? So what would the heart do? Another one will take charge, which is the AV node. So from the AC node, we move to the AV node. That's why your answer here is D. Your answer here is D. All right. Now, early repolarization of cardiac muscle cells occurs when good. So we can talk about what repolarization. Repolarization means what? The resting, right? For the heart to rest. So for repolarization, the sodium voltage gated channel is closed. Normally that gate is closed, whereas the potassium voltage gated channel will be open, allowing potassium ions to flow into the cell. This will then cause the membrane potential to become more negative. It will cause the membrane potential to become more negative. And the more negative it becomes, the more the heart begins to rest or relax. Okay. So that means that over here, in the position of the cardiac muscles, they get what they mean. So this is the acid potential. Again, when we are talking about acid potential, we will dive deeper into all of these things. But I don't want to confuse you over here. All right. Focus on the number 3. Focus on 3. So this is what they are referring to. This is what they are referring to. Repolarization. So during that time, again, we are saying that the potassium channels will be open, whereas the sodium channels will be closed. Inside the cell, it is made up of more of potassium. But if you open it again and you let the potassium go out, then the cell will become more electronegative. More electronegative. It might sound confusing and stuff. So don't worry. When we dive deeper into the topic, we'll discuss it as well. And if you're interested in that, let me know it in the comment section so that I'll do a video on the action potential for you guys to understand much better. So over here, your answer is A. Your answer is A. Which of the following is not true during ventricular systole or systole? During ventricular systole, which of the following is not true? So let's look at the diagram over here. So this is just simply telling you about the cardiac cycle. The cardiac cycle. So I'll first go through it for you before we come to the question, all right? So during cardiac cycle, the first phase, or one of the phases, is what we call the atrial systole, when the atria begin to contract, right? So that's atrial contraction forces the blood to move into the ventricles. I mean, it's understandable. Then we have the ventricular systole. We have the first phase and we have the what? The second phase. During the first phase, there is ventricular contraction, which will push the AV valve to close. Again, we talked about it in the previous question, in one of the previous questions, right? Saying that during ventricular systole or contraction, what happens? The AV valve will definitely close because of the pressure that is being built up in the ventricles. But in the second phase, what happens? To cause open or to open the semilunar valves or to open the aorta and then the aortic and the pulmonary valves, right? So that blood can be forced out of it. You see how beautiful it is. Then also how to call the ventricular diastole. When you say diastole, it means resting. Resting. So during the resting stage, pressure in the ventricles will reduce, and this will cause the semilunar valve to also close. So the blood does not flow back into the aorta. So that the blood does not flow back into the ventricle. Sorry. All right. They also have late ventricular diastole, where chambers will relax and blood flows fills the ventricles passively. Basically, that's the same thing we're talking about. All right. So the heart will relax so that the more blood will come in, more blood will come into the ventricles. As simple as ABC. So which of the following is not true during ventricular systole? A. The chorda tympani prevent AV valves flaps from flipping up into the atria. Yes, I agree with you. Because the chorda tympani is actually connected to what we call the piliary muscles, which so this chordae tendinae are connected to the valves. And when it contracts, it closes, right? Or when it pulls, then it closes the valves. So yes, during ventricular systole, that valve has to be closed. And when the AV valve is closed, it means that it is the help of the what? The chordae tendinae. Then I said that the intraventricular pressure will rise. Oh yes, it will rise. Because we just mentioned the pressure in the ventricle will rise. We said the AV valve will close. Oh yes, I also agree. The AV valves will close. So the atria will be relaxed. Yes, because it's contracting. The ventricles are contracting, so the atria will be relaxed. Also to be filling what blood from the vena caves. Then they are saying that the seminal valves will close. Is that true? Ventricular systole means ejection. So why would the seminal valves be closed? It should only be open. So which of the following is not true? Definitely, your answer should be what? E. The answer should be E. So that's how we've analyzed it. So over here, your answer is E, not A. The answer here is what is E. Let me just correct it over here. So E is the answer. E is the answer. All right. And this brings me to the end of the presentation. For those who care, you can check us up on medent12.com where all these videos will be posted there. Medent tutorials on YouTube if you are watching this video there. Instagram if you want to get in touch. Then on Facebook if you want to get in touch as well. So these are our social media handles. So do well to follow us, like, share, tell a friend, and let's make medicine easy. All right. So thank you and see you in my next video.